Hi, I'm Mark Nemours,
Hi, I'm Josie Nemours.
and we're the co-founders of Runway to Hope.
We started Runway to Hope with the hope that we would be able to service children and families here in Central Florida, to create something that was new and innovative, and to also do something special for each child and their family.
Runway to Hope's arrival to the Central Florida scene of philanthropy has made a sea change in how we care for children with cancer in the Central Florida community.
Runway to Hope is currently giving us resources to fund ablation technologies, a focused, safe, minimally invasive approach in which to treat painful tumors. Additionally, Runway to Hope is giving us the resources for the 3D guided equipment that we need to be able to access certain areas, and this will allow very quick recovery and almost instantaneous pain relief.
When I introduced myself as a pediatric oncologist, well, we didn't know that cancer even happened in children. Runway to Hope put that in the forefront in our local community. More and more people are aware of the problem and are aware that they need to help these families.
All the people who work in the hospitals are really the heart and soul of making these children feel so much better, not just physically, but really giving them the support that they need.
Many times this is the big event of their lives, the big event of the year for them. They see all of you on your feet, applauding and cheering and crying. With such raw emotion coming from them and from you, they understand that they are beautiful on the inside and beautiful on the outside.
We see them in the worst of times and we see them in the best of times, and almost always when we have a situation where it's close to the end, they're still talking about that night.
To see them happy and watching their families celebrate and their friends, that brings me great joy.
Nobody ever plans on cancer happening. And when it happens, it's devastating. It affects the entire family. And so as we started that first year with helping 4 families, last year we were able to help 64 families, and it continues to grow because of all of your goodness and generosity that you've given. You've helped so many of these children.
We're excited that we've now been able to not only satisfy 2 of the 3 pledges completely, but that we've now been able to add $1,300,000 on additional pledges to bring new areas of treatment, new areas of care to Central Florida. So we're excited about that, and without the public support, none of this would happen. With Florida Hospital, the new pledge is going towards renovations of the rooms that are taking care of all these kids.
We're looking forward to the new pledge of the inpatient renovation because these families need a place to live. Sometimes they're here weeks at a time, and they really need to make the environment not only safe for their children, but also comfortable for them and their families. The intent is to make these rooms a little bigger, a bed where the family can stay next to their child. Of course, the technology is going to change, better monitor. Also on the floor, we are planning on having a place where the family can retreat, perhaps a little place where they can eat their lunch there, don't have to eat it with the plate in their lap in the room. Hopefully make their stay in the hospital a little bit easier.
Amy Smith had a vision. She had different areas that she knew needed funding. She really saw this missing spot there, brought in a team that she'd been working closely with, and said, let them share their experiences and stories and why there needs to be funding here.
Before I came to Arnold Palmer, they were interested in building a brain tumor program here at the hospital. And one of the things that allowed them to really have that ability was Runway to Hope. When I came to Arnold Palmer, not just by myself, but with a small team of people, a social worker, a dedicated nurse practitioner, and a research coordinator, Runway to Hope committed $1 million to Arnold Palmer Hospital, and the hospital chose to invest that in the development of a pediatric brain tumor program. Palliative care as a discipline, I really think adds a tremendous amount to walking through the journey. It's a very difficult need to fill because it requires people, physicians, social workers, nurses, nurse practitioners, having a lot of time to invest into people. Much of that time is not reimbursable. And so having philanthropic support to provide that service is critically important in order for it to exist and to grow and to be able to fulfill all of the aspects which we would like to see it fulfill. The funding that Runway to Hope has provided has just been tremendous, and none of these things would have been possible without that.
The public here in Central Florida is saving lives and making lives better.
What is up, guys? Grayson here. Today I'm going to share my story and my journey through cancer.
He came out into the kitchen and he said, "Mom, what is this huge lump on my neck?"
The lump was the size of a golf ball. It was huge.
So we went to the walk-in clinic because we thought we would just get a couple antibiotics and then go right to baseball. And the walk-in clinic said you have to go immediately down to Florida Hospital for Children.
Quickly, scouring the internet of lump in the neck, and probably the first 100 searches comes up with cancer and lymphomas and tumors, and your mind is like a tornado.
So they rushed me down to the hospital. They put the IVs in. They told us, hey, your kid has cancer.
They run a battery of blood tests that of course are off the charts abnormal, and they decide to remove the tumor from his neck to do a biopsy of it. And the results came back as stage 2 classic Hodgkin's lymphoma.
Statistically speaking, when they told us there's a 95% chance that this is a cure rate, we were like, okay.
Unless you relapse within a year, of which he did. And then with a stem cell transplant, of which he had, your chances go down to about 60%. Unless you have a chemo-resistant tumor, of which he had, which means it doesn't respond to the chemotherapy. So they did have to surgically remove that tumor, and then his chances go down considerably. We don't even discuss the chances now because they're considerably lower.
When I went home that day, my mom calls and she says, Grayson, you have cancer, and I started bawling my eyes out because that was so sad.
He continues to tell us that, I want more people to see what I'm going through. Maybe I can help them go through something. He gets people subscribing to his YouTube channel, and they ask him questions, and we tell him, hey, look, people are talking to you, you have to respond back. So that's become part of his branding.
This is my YouTube page where I make all of my videos. So far I have 223 subscribers. And this is the part where I crack eggs on my head.
Oh my gosh, it's so hard-boiled!
He'll overcome this. He'll move past when he can start to go back to school again and interact with his friends. He'll be okay.
Thank you guys for watching my journey. See you later. Bye.
It's really, truly incomprehensible to hear the words from your doctor, "I'm sorry to tell you, but your child has cancer." And it's all the more incomprehensible to hear the words, "I'm sorry, but your child is not going to make it."
Kashmir was diagnosed with leukemia, ALL. She was just turned 7. I remained in the hospital with her. She was in there for like 3 weeks, and I had, my 3 other sons. Just threw our life out of balance. Her first treatment was 2.5 years. I wasn't able to work and wasn't able to be home and take care of my younger son. Because of Runway to Hope, I wasn't as worried financially because I knew we would get assistance. I wouldn't have been able to sit in the hospital and not worry about, oh my God, the electric's gonna be turned off on my other kids, or, we're not gonna have food or anything like that. And that just brought me comfort knowing that we had that. Dr. Barrero had left a message saying he needed a call, and I just knew at that instant that she had relapsed. A couple weeks later, she did ask me if she was gonna pass away, and I told her, absolutely not. There was one time, Kashmir, I had to go in for
a liver biopsy. And the last coherent thing she was ever able to say to me was, "I love you, Mommy." She knew she wasn't coming out of it. She coded that day 7 times. So I held her and told her I loved her and told her not to go. I didn't want her to go. Then they called the time and I knew she was gone. And then I got to hold her for a long time afterwards. I'm gonna start to smile. I wanted that one last time.
There is going to be an end one day to cancer. It will happen if you continue to do the great work that you've been doing.
You, Central Florida, have been here for these children of Runway to Hope, so we thank you from the bottom of our hearts.